flu is a virus, causes the common cold. We happen to have a high level of activity in LA County and throughout the United States of the flu. The CDC publishes is showing that we're having a high level of activity, and this could be one of the worst flu seasons in years. Right now we're seeing predominantly influenza B, but that could switch over to influenza A. Symptoms are similar to the common cold. You're going to have fever, cough, congestion, sore throat, and body aches. If you have more severe symptoms such as shortness of breath or chest pain, or you're confused, if they're very severe, you should be calling 911 ambulance to go to emergency room. Not as severe, going by private auto to emergency room. If you have some of the more minor symptoms of just fever, congestion, cough without the shortness of breath or chest pain, then an urgent care would be appropriate. The best preventative measure for avoiding the flu is the flu vaccine, and that's recommended for anybody over the age of 6 months. Any other common measure you'd use to avoid contact with an infectious illness, whether that's wearing a mask, frequent hand washing if you come in contact with somebody that may be sick, are all important things too. It's always a good time to receive a flu shot while there's still flu activity out there. It's still going to help you prevent getting the flu. It may take 2 weeks for it to be fully effective, but it'll still eventually help you prevent to get the flu if you come in contact with it. There are various treatments for the flu once you do actually get it. For somebody who has a accompanying illness or is less than 2 years old, you should be getting the treatments even before you get any confirmatory testing of the flu. For some people, for the other people who aren't in the high-risk categories, they need to start the flu treatment within 2 days of having symptoms, otherwise it's not as effective. The most common flu medicine is Oseltamivir, and there are 3 other formulations that work similar, and there's even an IV formulation for people who are admitted to the hospital.